This is the Psychedelic Medicine podcast.
Hello and welcome to the next episode of the Psychedelic Medicine podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and today we're going to be discussing psychedelics for postpartum mood disorders with Melissa Whippo. Melissa is a licensed psychotherapist who specializes in the intersection of women's health and psychedelics. She founded a nonprofit, Deva Collective, which has fiscal sponsorship from MAPS, and is currently conducting research about perimenopause and microdosing San Pedro. Now, before we get to Melissa, just a reminder that the Psychedelic Medicine podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And one more reminder, if you happen to be a medical professional of any sort and you'd like to learn more about perhaps the intersection of women's health and psychedelics and all other psychedelic topics, please check out the Psychedelic Medicine Association. It is our mission to educate clinicians of all varieties on psychedelics so that you feel comfortable discussing them with your patients and referring when appropriate. You can check us out at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Melissa.
Thanks so much for having me. It's wonderful to be here.
It's wonderful to have you because it is no secret, if anybody has heard me on other people's podcasts, that I'm very passionate about there being more research into psychedelic medicine use in women's health conditions. And so I'm very grateful that that is definitely something you have focused on. And we are just to, we did a Psychedelics of Women's Health episode exactly a year ago, I think at this point, maybe two, with Ali Fiducia, where unfortunately, we were mostly speculating because there has not been that much specific research done on a lot of these topics. And so very excited that we're starting to get some more research and that you have done some of this particular research. So as we're getting started, if you could just tell me a little bit about how this became a focus of your work.
Yeah. My background clinically is in social work. So I was working at UCSF here in the Bay Area in the obstetrics clinic for about 10 years. We had a clinic called the Pregnancy and Postpartum Mood Assessment Clinic. Terrible name, but really good work. So I got to see all of our patients who were either considering fertility and wanted to look at their mood disorder medicines. We also had a psychiatrist as part of the team, and then women during pregnancy and postpartum who were suffering from anxiety, post-traumatic stress disorder, depression, sometimes psychosis. So about 9 years in to doing that work, I was feeling pretty burned out, and I had been working with plant medicine. And one of my teachers in the plant medicine world suggested that I do a ketamine-assisted psychotherapy training. This was in 2018. And so I did. And as I was in the training, I was wondering, well, has anybody ever looked at ketamine-assisted psychotherapy for postpartum depression? So I raised my hand, and Phil Wolfson was leading the training, and he said, well, let's do a study. And I had just met him, and I was like, okay, people say things like that. But then
Right.
About 2 years later, at the end of 2020, the end of 2019, a year later, we had started a study looking at how breast milk interacts with ketamine, so that once we had that information, then we could make clinical recommendations, because that's the first thing when we looked at the literature, there was nothing there about ketamine assisted psychotherapy for postpartum mood. So there was also nothing in the literature about how ketamine interacts with breast milk. So that was the first study that had to be done. And we published that 2 years ago in 22. Yeah.
Fantastic. I love that so much. And that's a good enough place to start. But I think you've brought up two key issues. Is one, we always need to know how the psychedelic may specifically help the postpartum mood condition. But also the secondary is always, is it appearing in breast milk? If those same mothers having the mood, the mental health issues are breastfeeding, right? And those might be two, it may be like, yes, super effective for the mood condition, but way too high a level in breast milk to be safe for the baby, right?
Right. And sometimes what happens, I mean, with a drug, there's a drug on the market called brexanolone, and it is touted as having, the research suggests that it has a very good success rate at treating postpartum depression in particular. However, the treatment itself is very expensive. It's an IV treatment, and the mother has to stop breastfeeding for exactly the reasons that you said. The medicine is toxic to the baby and it does pass through the breast milk. So she also has to be hospitalized for the course of that treatment, which is intravenous. So, in my view, there's a bond disruption, and the numbers show us this is not always true, but women who are having postpartum mood concerns often have difficulty bonding with their baby in the first place through no fault of their own. But, you know, the reason why ketamine and other psychedelics appeal to me more is that it's not a medicine you have to take every day. And it's not a medicine that's going to cause a significant separation like a hospital admission would.
Yeah, that's a very good point. And before we dive into it, if you could just spend a minute, you hinted at it when you were talking about your work back in the OBGYN
Mhm.
in at UCSF, the department there. But can you talk a little bit about how serious some of these mood conditions can get?
Oh, I mean, and I don't like to scare people or, use incendiary language, but the truth is, I mean, postpartum psychosis is real. It does impact only 1 to 2% of the birthing population. Because I really just want to name that a lot of birthing people do not identify as female. So we're talking about the whole spectrum of birthing bodies. And, folks who are having difficulty with their mood, it can be very, very serious to the point where they're not functioning at all. And so there has to be not just a medical intervention, but also kind of a wraparound care intervention for the whole family. And at the less intrusive levels of concern, if a parent has the blues or more mild depression, that's still going to impact the whole family, because we look at it from a systems perspective. The parent who just gave birth is often the emotional center of the family. So what they are going through is going to impact everybody else in that
Yeah.
system. Yeah.
Absolutely. And how prevalent are mood disorders or let's say, how do you keep saying mood? Um,
Mood
what is the
concerns.
concerns? Mood concerns. Yes, I have it written right in front of me. There it is. How prevalent are mood concerns in the postpartum population?
Unfortunately, pretty prevalent. I mean, the reported numbers are 20%. So that's about 1 in 5, 1 in 7. I think the numbers are actually higher than that because I still think that a lot of people don't report to their healthcare providers the truth of what's going on. Um, and I worked with some wonderful people, OBGYNs, who had ways of asking the questions. One of them would say, "Is it everything that you expected at the postpartum visit?" And if the
Mm,
person started crying, or that was a way to kind of get in the door where they felt safe to reveal that information. But a lot of folks, when they're filling out the questionnaire, they don't want to be truthful about how they're feeling because they're worried that that means someone's going to take away their child, or someone's
mm.
going to decide that they're not fit to be a parent. And they're already having those concerns on the inside. So reported numbers about 20%, but I think it's actually higher than that.
Yeah, that makes a lot of sense. And just for a preview, we are going to be talking about your ketamine and the breast milk study, but also you've done a lot of work with moms microdosing. So I just want to give people that to know that we are going to be covering a number of things. But outside of those specific things, what in more general have you seen as trends in postpartum populations with psychedelics that have been showing efficacy?
Well, and I'm glad you used the word trend because this is all purely anecdotal. There's no evidence based information that supports any of this. However, um, most women, most moms that I talk to report great success with microdosing, particularly with microdosing mushrooms. A handful who microdose LSD, but mostly folks who microdose mushrooms tell me that their mood is steadier and more uplifted. They feel like they have energy for their partner and their family. They're sleeping better. Um, yeah, it just helps them feel all overall better. I know a lot of mothers who work with cannabis in that same way. They're very mindful about how they work with cannabis. As I'm speaking, I'm so aware of how, um, how startling this is for some people to hear and how much judgment comes into play. There's an organization called Planned Parenthood that Rebecca Cronman is one of the, you know them, and Rebecca Cronman is one of their founders. And she and I just had a conversation about all of this for Fluence, but parents really need a lot of support. And oftentimes, the psychedelic medicines are what work. We see a lot of advertising for parents to drink alcohol. And I'm not alone in feeling like this is a terrible idea. Alcohol is a depressant and it's very impairing. And as someone, I was a child who had a parent who drank too much. That's not a fun thing to grow up with. Now I'm a therapist. So, you know, I don't know about other parents, but I don't need my kids to see me altered in this way. So I think responsible, mindful, sacred use with psychedelic medicines, a lot of parents are reporting to me, are very helpful for them personally, but also for their relationship, for their partnerships.
Yeah, absolutely. And since you brought it up, even though it is completely off topic, do
Yeah.
we know if cannabis shows up in breast milk?
I believe it does.
Oh,
There is Jeff DeVito at UCSF has done some presentation about cannabis use during pregnancy and postpartum. The research is not great for support of it. There's not
yeah.
his view and others feel like it's not great, but there's so much unknown. I say that, and I have no idea. I have seen, again, anecdotally, many children who were born to mothers who were using cannabis during their pregnancy. Children were completely fine, within normal limits, healthy, all that. But
Yeah.
there aren't any studies with SSRIs either. Longitudinal studies, I think, end at age 12, something like that.
Mm.
So we don't know what teenagers look at, like whose moms took antidepressants in pregnancy, things like
Yeah,
that.
absolutely. And if listeners want more information, it
Mhm.
was, he called it out, the kind of irony of it himself, but we had Ben Malcolm, the pharmacist,
Oh
on
yeah.
doing, evidence of psychedelics, what he could find as far as research or historical use of psychedelics in pregnancy and breastfeeding individuals. And he said, like, I'm sorry, I'm a man giving this topic, but he said, all I was doing was collecting the data, because people kept asking him, and like you said, there's just not much data. It's hard to find it. And so, we do have to kind of sometimes look at trends, of what's reported. And so I appreciate that you are kind of on the ground level, observing the trends and gathering the information. So let's get into what you and Dr. Wolfson did find in your
Mhm.
study of how ketamine does or doesn't show up in breast milk. What did you find?
Well, it was really interesting. We found that no matter where the subject was, the volunteer, we had 4 volunteers. The results were so unanimously similar that we stopped there to publish that info. But different, diverse backgrounds, different ages of the children, so different stages of breastfeeding. The protocol was it was all intramuscular route of administration, zero point 0.5 milligrams per kilogram dosing for the first round. And then a week or two later, the second round, we did 1 milligram per kilogram dosing. We had them pump before they were given the medicine. They received the medicine, and then at 3-hour intervals, they would pump their milk. I would take the little vials of breast milk to the lab at San Francisco General. And our wonderful people there who were helping us with the study also happened to be lactating, one of them, and provided her milk for the control.
Nice.
And what we found, first of all, I want to say, and this is not I can't make clinical recommendations. I'm not a physician. I'm a therapist, but so many people are curious how much medicine passes through breast milk. So more SSRI, which is still considered safe by the medical profession, more SSRI passes through the breast milk than ketamine, probably nanograms. And ketamine has such a short half-life in the system, particularly with the intramuscular route of administration, that 12 hours after dosing, the breast milk was completely clear.
Wow.
So if someone wanted to be really safe and make a plan for alternate feeding during that 12 hours, they could, and pump and discard the milk for
Yeah.
the 12 hours. Yeah.
Wow, that's fantastic.
Yeah. I don't
And
think
like,
anyone wants to come out and claim that that's an official recommendation,
right.
but it's there for
But
people to
that
do.
the data show that at
Yes.
12 hours there is that's incredible because as you pointed out, this ketamine is not a daily medicine. And so,
No.
I think most of the more commonly used protocols are about twice a week for 3 weeks, something like that. And so, like you said, if you definitely doable to make alternate plans to, pump in advance or whatever you need to do kind of thing. I have never, nor will I be a mother, but I'm just guessing as to what people do. So I think pumping in advance is the thing, right? And
It is. And so that's, as we're talking about it, I'm thinking about how, you know, you have to have resources to be able to access this treatment, right? You have to have childcare, right? You have to have the means, transportation means to get yourself, unless someone will do a home visit for you, which we can talk about that later, but I'm a fan of that for mothers in particular. Um, it's a lot of doing and paying for the session itself, which is expensive and which is not covered by insurance. Spravato, which is the only FDA approved ketamine product, is not permitted to be administered to lactating women.
interesting.
Yeah,
And then we're back to the same issue where lack of resources can compound those mood concerns.
of course.
Yeah,
Yeah. Yeah. If you're
very unfortunate.
struggling and you
Yeah.
have a wage earning job and you don't have childcare, you can't take the day off to do a ketamine session. Who's going to watch your kid and what? Yeah.
Yeah, definitely. I am envisioning hopefully some entrepreneur is thinking in the back of their head like ketamine centers for mothers that have like a daycare center built
Right?
in. Yeah.
Gyms have that. Why not your healthcare facility? Drop
Yeah,
your
that
baby off.
right. That's seems like the most important place that should be ready for you at a moment's notice if you need to bring in, especially if you have more than one child. Well, that's fantastic, important information to know. And I what short outside of the breastfeeding, what kind of improvements in mood concerns in the postpartum realm have you seen with ketamine specifically?
With ketamine specifically, and again, anecdotal, from, people that I've seen in my practice, but actually quite a bit of benefit. Um, and I'm thinking of one person in particular who was also taking an antidepressant. They were taking sertraline or Zoloft, which is what is most commonly prescribed to postpartum folks, because it is said to have the least amount of medicine pass through the breast milk. Um, but it's still, a moderate amount. But she found that with the ketamine, she was able to access a part of herself that she had only, in her conscious mind, in her day to day conscious mind, that part of her had only been reserved for her children. This very kind, compassionate, loving mother inside, she could access for herself, and she saw herself as an infant in the journey space. She had very little medicine. Um, and she had a beautiful journey experience, and the benefit for her, and again, she was also on an antidepressant, lasted for 6 months. She didn't need another ketamine session for 6 months. And we were doing regular therapy at the time, weekly or every other week. And I had been seeing her for years. So the relationship was there. But the antidepressant effect of the ketamine certainly seemed to help her. And that's what ketamine does, I think, so well, is gives people a different view of some of the things that they're really struggling with, that they can't quite break through, some of these more recursive ruminations that seem to befall mothers quite a bit. And they're usually pretty negative, you know. But the medicine space gives them a different view. She was able to access something that was there all along, but she was blocked to seeing that in herself. But the medicine helped her through that.
I was going to ask if there, we know that certain psychedelics like ketamine and
Mhm.
psilocybin have shown efficacy for depression, let's say regular prepartum depression. But is there any difference, do you think, in how those medicines would be able to address postpartum depression?
Absolutely. I mean, we know in the immediate postpartum, the body's estrogen drops, it plummets. It doesn't just kind of gently titrate down. It's been gradually building the whole pregnancy, and then it plummets after childbirth. And that's why so many women, they think about 80% of people have the baby blues, which is not considered to be, needing treatment officially, usually with rest and self-care and all these things. But again, got to have resources for all that. So it seems to me that that low estrogen is kind of a breeding ground for some of these bigger mood concerns to develop, particularly with the combination of lack of sleep, maybe predisposition. If you've had any episodes of mood concern in the past, that's going to make you more at risk. Um, and if you're breastfeeding, there's lots of mood and hormone fluctuations with breastfeeding. And we're seeing anecdotally that ketamine can be helpful for that. I would venture psilocybin as well. We just don't have any information about how that works. But anecdotally, I've certainly seen it.
I'd be very interested to see if there's, hopefully research done in the future on how the psychedelics, if there's any impact on hormones, like
Sure.
themselves, right? As opposed to working on the kind of the effect of when a hormone drops, but it'll be
Yes.
interesting to see if there's that direct effect.
It seems so. Phil and Julaine at their clinic were looking at this. Hopefully, they'll write it up, but more so for PMDD, premenstrual dysphoric disorder, where women sometimes will take an antidepressant around their menstrual cycle. They're finding that lower doses of ketamine, taken over a few days during those difficult days in the cycle, seem to help. So I don't know. We don't know, but maybe.
Yeah, very interesting. And if we could now focus on you said you wrote an article last year that was
Yeah.
in, tell me, did you say the Washington Post?
Washington Post.
Okay.
Yeah. Yeah.
On mothers who are microdosing.
Yes.
And can you alluded earlier to some of the benefits they're finding. What are some of the things that are leading them there? Is it mostly the postpartum depression? Is it the baby blues? Which of the kind of constellation of things most leads moms to want to give that a try?
Yeah, I think yes, all of the above. And I think sometimes somebody will have postpartum depression or postpartum anxiety, or maybe they had a traumatic birth and they never quite get treatment for that because they're busy and they go back to work when the baby's 6 months old, and they just kind of go for it. My 15-year-old calls it thugging it out. They just kind of thug it out. Like mothers are so programmed for that in our society, just keep going, just keep it moving. And suddenly they have a toddler and they're realizing this doesn't feel good to me. I don't feel great. And what I would hear a lot from moms, and I live in Berkeley, California, I practice here, so it's not surprising. They would come to me and say, I want to do something natural. I keep hearing about mushrooms. Mushrooms are natural. I don't want to take a pill. I don't want to take an SSRI. Or they've said, I took an SSRI in the past. I didn't feel like it helped me. I want to try something else. So that's, the piece that I wrote was about how, and it's kind of like a network of moms who are talking to each other, and these are the things they're talking about. I would bet that if you go to a park on a Saturday morning in the Bay Area, you could probably overhear several different moms talking about psychedelics or microdosing. It's great.
Yeah, well, that brings up something because and so many cities have decriminalized that I've lost track, but
Yes.
Berkeley is decriminalized, correct?
Yes, and Oakland as well. Yes.
Yes. So they
Yeah.
have safer
There's more
safer
access.
access. Yes.
Mhm. Yeah, there's easier ways to find, and it's a tricky gray area for licensed clinicians. We have to be really mindful and careful, and um, but there's information that's out there that people have a right. A lot of folks who talk about stewarding indigenous medicine and the original medicine keeper talk about these medicines being for the people, that nobody needs to be a gatekeeper, especially, a person like me, a white person, a gatekeeper to these medicines. So, and the Washington Post, the reason why they agreed for me to write that article and talk to me about it was they like to provide something called service journalism. So many people are interested in trying some of these modalities. And what do they have to go to? Reddit, maybe Arrowhead if they know about Arrowhead, but a lot of people don't know about Arrowhead. So how do we provide resources that people can access to support their explorations in safe and healthy ways? And moms are no different.
Yeah. So, you brought up a good point, because when you said mom's microdosing, I was just picturing it was the same postpart, like immediately postpartum. But you're saying
Yeah,
this is m- more common in like toddlers, or as they're growing older. Is it all stages of motherhood you're seeing
all
this in?
stages of motherhood is what I'm seeing. Yes, and yeah, there's a woman, Michaela De La Mico, that you can find online, and she talks about it a lot, about how important it is actually to support mothers in particular with sacred medicine. And if we look at different indigenous groups over time, there were many mothers working with sacred medicines. So it hasn't been written up, it hasn't been, talked about, but I think in our culture in this country, there's so much stigma around mental health. You're damned if you do, you're damned if you don't. You're damned if you take an SSRI or if you microdose mushrooms. Somebody's going to say that you're doing something wrong. So
Yeah,
it's
that's a
tricky.
very good point. I know that this is not exactly on topic, but do you happen to know if anything in Oregon is where there is a legal paradigm? Do you know if that's anything's looking to be aimed at the postpartum population there?
No, but that's such a good idea. If anyone is thinking about it, you
Yeah.
should definitely do that. Well, I just think it is a specialized care. I do have a dream of creating some training specifically about this group of people, because it is a specialized time, and when we're working with medicines, it's important to understand the nuance of the body moving through these particular times, whether it's a body that's breastfeeding or healing from a c-section delivery, or on and on, or healing from a miscarriage or healing from an abortion, or you know
Yeah, and when you just brought up the C-section, that it occurs to me that there's probably a not insignificant level of postpartum pain.
oh
Is
my
that
god.
something ketamine has been used to address?
It's interesting, yeah, that now that we're talking about this, there's one study where I think it was in China a few years ago. They gave women during C-section delivery, they prophylactically gave them a bolus of ketamine. I'm not sure what the dose was, but to try to prevent postpartum depression. And I think it was relatively successful. I don't know about the cohort and I don't know the numbers, but it's a study that people cite when they're talking about ketamine for postpartum.
And they
But
found that
yes,
to be efficacious?
they did. Yeah. And, for pain, oftentimes women after a C-section are given narcotics, are given Oxy or Percocet. And I was fortunate enough not to need those medicines, but, and I can't really, or they'll give you Tylenol with codeine, but I couldn't handle any of that. So, um, and I wasn't working with psychedelics in the postpartum period. I mean, I kind of wish I had been, because I think it
Yeah.
would have been helpful.
Like, rewind the clock.
Right. But I would love to support women who would make that choice for themselves now, because I can see how it would be so restorative to the body.
Yeah, absolutely.
Mhm.
And just since we brought it up in your bio, I know you have a study upcoming
Mhm.
with microdosing San Pedro. Can you talk
Mhm.
about why for perimenopause? Can you talk
Yeah.
about why you that substance was chosen for, I know we're taking a vast swing from people who just
That's
had a
okay.
kid to people who will never be able to have a kid. That's the the perimenopause group that I am definitely
Me
in.
too.
But and very excited to hear about any kinds of developments you have. So,
Yes.
interested as to how that was chosen as the subject of your study.
Yeah, thank you. So my teacher, also my husband's teacher, and she officiated our wedding, Francisca Santibanez. She has an organization called Plant Spirit Talk, and she teaches South American and Andean herbalism. In Spanish, it's called vegetalismo. So it is the use and work of sacred plant medicine, not always psychedelic. But she and I were talking, because I did an apprenticeship with her, and she's a close mentor of mine. And we were talking about, I wanted to do our first research project for the nonprofit about perimenopause, because it's a little easier to do a study on a population that's not breastfeeding to the powers that be, and and we were talking about San Pedro, or Huachuma, as it's called, in the Andes, because it's a medicine that is very even though it's Schedule 1 medicine, it's very easy to access in North America, particularly where I live in the Bay Area. Michael Pollan talks about it. It grows in everybody's yard. It's easy to access in a good way where you're not exploiting anybody or anything. And so that was where the idea came out. And then when I was reading all of these articles about mescaline, which is the active ingredient in this cactus, mescaline happens to be very anti-inflammatory. So it furthered our feeling that microdosing. So microdosing is meant to be a subperceptual experience. It's not a high dose journey dose of medicine, which on San Pedro or mescaline can last 8 to 10 hours with a journey dose. But in microdosing, I'm not sure actually what the dosing would be. I know with mushrooms, for me, it's about 100 milligrams or about a tenth of a gram. So I would imagine it would be about the same for the San Pedro. But microdosing could be every 48 hours or every 72 hours for a month, depending on how you want to do it. So the way that we are doing our study, we can't, because it's Schedule 1 medicine, we can't supply the medicine. We can't actually promote people to start a new practice of it. We're hoping to capture. So if you're out there and you're perimenopausal and you happen to be microdosing San Pedro, start now. We're going to be recruiting people's information, and we're going to be keeping everything confidential because they're giving us their, illegal activity that they're doing. So it'll be all confidential, but we're hoping to, it's not an efficacy study. We're not looking at the efficacy. This is a thoughts, feelings, opinions of people who are microdosing San Pedro during perimenopause. We have to do that first before we can do the next thing.
The steps, yes, all the studies.
Otherwise, it's an investigational new drug study, and we're not well resourced enough to do that yet. Yeah,
Understand, but your study can always provide the basis upon which one of those IND studies could be done. So thank you.
Maybe so. Yes, please.
Yes. Thank you very much for doing that work. Is there anything that we haven't covered in the realm of, let's say, I would say women's health, but we could say if we did women's health, we could do a whole probably talk on PMDD, which I am,
Yes.
very interested. Let's have you back. It's like
Yes,
maybe we
please.
could come back and we do an entire episode on that. Would love that.
Yes.
But yeah, anything that we have not covered in the postpartum breastfeeding mother arena?
Well, just that, I always like to tell people to proceed with caution, particularly in severe cases of postpartum mood concerns. Let's say someone is nearly psychosis or quite psychosis or suicidal. There is some evidence to suggest that ketamine can be very useful with acute suicidality. However, I think you will have to be really careful with a postpartum mom, and she still has to have 24/7 round the clock care. I think you could still explore using ketamine in this event, but I think you have to have it's not a substitute for all the other pieces. And you just have to tread very carefully and make sure you have a good interdisciplinary team of people caring for this person and this family, because it's really the whole family who needs support.
And I
Yeah.
think you reminded me of a point that you made earlier, but you had the patient who had done ketamine, but she had continued to do therapy with you even after the ketamine
Oh, yeah.
session. And so I am assuming that that is probably another key portion of this, is that most of what
Yes.
you're talking about is not in in isolation. There's probably a therapeutic component to a lot of it.
Absolutely. Yeah, 100%. Because the relationship has to be there in order for the medicine to work effectively. Because stuff can get opened up in the medicine space. You want to have it's a round trip ticket. I tell people it's a round trip ticket. We're going to be right here together again, and we'll keep going together. No one has to be alone with any of that.
Yeah, absolutely.
Yeah.
Well, I think that is a beautiful place to wrap up our discussion. Can you please tell people where they can find more about you and your work?
Yes. So our website for the nonprofit is Deva, Deva. It's a Sanskrit word, devacollective.org. My personal website is melissawhippo.com. And yeah, those are two good places to start.
Excellent. Well, I very much look forward to having you back on and having much more discussions in this. This is our public service announcement call for people to continue to do psychedelic research aimed at women's health issues, women's wellness. We don't always have to be looking at a condition. We just let's figure out what time in the menstrual cycle people should be most, or which day would be most advantageous to do psychedelics with,
Mm-hmm.
hormone levels being what they are. Let's see what effects psychedelics have on the menstrual cycle. Let's get investigations done in all these areas. If we've got some PhD students out there or candidates or people in a master's program, let's just plant some seeds for some
Yes,
areas of
please.
research. Yes, yes. Well,
Yes.
Melissa, thank you so much for coming on and discussing all of your research and your experiences with us.
Thank you. Thank you so much for having me, Lynn Marie. It's wonderful to be with you.
Absolutely. All right, for everybody else out there, until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.